Alright guys, we're going to go over Ards. So the information from this was taken from the Advanced Modes of Mechanical Ventilation. So we've got the ARDS here in the middle, so that's what we're going to talk about. So let's first go up to the definition. What is the definition of ARDS? So it stands for Acute Respiratory Distress Syndrome. Some other ways that you can define it. If you do your ratio of the PaO2 over the FiO2, if it's less than 300, it's a mild case. If it's less than 200, it's moderate. If it's less than 100, it's severe. So another aspect where you can define ARDS further, which is down here to the what. So the chest x-ray will show bilateral diffuse infiltrates. When you do your calculation, it's going to be less than 300, so that's a good indicator as well. So if you have a patient of ARDS, right, so why does this occur? So let's go up here to the why. So ARDS occurs because there's an inflammatory response in the lungs, usually from an acute problem. They can occur with anybody, so it's just something to keep in mind. Up here, obviously, with ARDS, we go off of the ARDS network. And the reason why is because they base all of their protocols on best evidence practice and to prevent further lung injury. And if we want to talk about who they are, it's a research and physician team that formed the network. And ARDS can occur in any respiratory failure patient. So it's something to keep in mind. That's the reason why we always check all of our numbers when we're doing vent checks, because we're constantly checking for that. So if we go down here, when ARDS occurs, there's some different ways you can manage it. So you want to keep your tidal volume 6 to 8 milliliters per kilogram. You can do an optimal PEEP study, just like we talked about with the oxygenation. You can maintain your plateau pressures less than 30. You can prone your patient to increase the oxygenation. And here's another aspect to increasing your oxygenation. You increase your I time by decreasing your flow. So this is ARDS. You guys can look up the PowerPoint if you want further information, but this is just an overview of some items to keep in mind for your test.